initiatives in Tamil Nadu. You look at the e-health, which is the initiative that's coming in Kerala, a very ambitious transformational project. I thought I'd leave the initiatives and just talk about innovations over the next 10 minutes. As we're talking of healthcare innovations, let me create the backdrop. As we sit here and you're seeing the presentation, there are 1.78 deaths every second. We're talking of healthcare, so please indulge me. I'm starting off talking of deaths. That actually translates to what? 107 deaths per minute, and I'm talking on a global scale. If you bring that down to the Indian scale, there are 10 deaths that are registered every minute in India, and it is estimated there's at least half a number that goes unregistered. So we're talking of around 15, 16 deaths every minute that happen here. And what are we doing in healthcare to be able to reach out to these people? Because we know 53% of deaths are because of chronic diseases. And I was reading the Health magazine yesterday, the editorial, Dr. Gupta, I don't know if he's here, he talks about the medically excluded masses. And if you look at that, there is a significant number of people who die because we are not able to reach medical attention to them. And another statistic that will come in handy here as the backdrop, as I'm talking of innovation, is India. We feel proud. We are 10th in terms of ranking worldwide per GDP. We are the 10th largest nation per GDP. But if you bring that into the healthcare scenario, we are at the bottom 5. Okay. So we at Accenture and the Accenture Technology Labs and the Accenture Healthcare Foundation Research is trying to see how do you bring innovation, leverage technology, leverage the healthcare initiatives that the government is doing, and we have the Principal Secretary, Additional Chief Secretary Maharashtra, we have officers from Tamil Nadu. They're doing a lot of initiatives. So how do you leverage that spending to reach more people than what is intended? And so I thought I'll just touch on 3 areas. In 10 minutes, you can't talk about too many. One is patient care and elder care. The second is pregnant women and children, infants. And the third is eye care, and I'll say why eye care. So if we were going to the patient care and elderly care, and we're talking of the continuous monitoring of vital signs. Today, if you've ever gone into a hospital, and not because you're unwell, you're looking at somebody who is in a hospital, you will find a nurse coming to the hospital bed at least 3 to 4 times a day to take your BP, to check your temperature, to check your oxygen, to check your heartbeat. And that's if you're in a general ward. If you're in the ICU, you have these scary looking instruments all around you and you've got these plasters across you. Keep that on one side, and on the other side, think of the Johnson's Band-Aid and think of a digital plaster that looks like a Johnson's Band-Aid. This little strip that you're seeing in this picture here, it monitors right now 5 vital signs. It can check your temperature, it can check the oxygen, it can check your pulse, it can check your BP, it can check your heart rate. So as we have shortage of nurses, imagine a patient lying in the hospital. The nurse doesn't need to come 5 times a day. This is going in to the nursing station as a continuous feed. If you're in ICU, instead of putting equipment worth 2.5, 3 lakhs to monitor all this is just coming to you automatically. That's one side. Look at patients who have been discharged from hospital post-surgery, and sir, you would agree that if you go to a specialty hospital, say cardiac, and if you come to Trivandrum, go to Chennai, nearly 30 to 40% of people who come for the surgery are not from Chennai or not from Trivandrum. They come from outside. Okay? So after the surgery is over, they're monitored and they're discharged, and the doctor says, come back after 1 week. So the poor guy comes back, he doesn't come alone, he's a heart patient. There'll be 2 people who will come with him, they'll wait in a long queue to meet the doctor, and what does the doctor do? He takes his ECG, he checks his BP, he may check his temperature. They normally don't check your oxygen. Whereas in this case, The patient, after being discharged, goes home, they put on this plaster, the reports are coming to the doctor continuously. And you can set parameters that if the heartbeat drops below 60, the doctor will get an alert. If the heartbeat goes over 120, the doctor will get an alert. So over the phone, you can taper down medicines or even change medications. And so we're talking of digital plaster because we see this innovation completely changing the way you do patient care and elderly care. You can use it now for elderly care. We've done pilots in several leading hospital chains across the country. We're even doing a pilot for elderly care, what they call senior citizens who live in retirement homes. They don't need to come to the doctor, or a doctor doesn't need to go there a week. This is automatically coming in. So this is one area of vitals monitoring as a service, which we see as a paradoxical, a paradigm that will completely change the way of healthcare, and this is an innovation we're driving. Pilots are on, successful commercial launch is scheduled soon. That's in India. The solution is currently being used in several parts of the world, including the UK. This is a project funded by the NHS. The second area of innovation I wanted to touch on is eye care, and you may think, what's so special about eyes? And this is a chilling fact. It may make all of you sit up. I know I'm between you and the tea break. 40% of global blindness is in our country. And this blindness is not congenital blindness. This is blindness over a period of time because of, either you've not diagnosed it correctly in time or they've not got the right care. Today, this is how it is done. You have the hospitals doing camps. People go out to individual houses in the remote areas in the village, collect data and feed it back. They do a camp. And here we're driving innovation where someone's going with a handheld device. The data is all digitized, how many houses he's going to. He's meeting with the patients that need their eyes tested. Camps are organized. And, from that camp, you're able to tell them whether they need to go in for glasses, they need a cataract removal, or they need surgery in our hospital. And that is organized. So earlier, if somebody was doing 3 houses in a day, it's gone up to 2.5 times that number now. And this is the innovation that we're driving in eye care. The digitization also helps you to be able to remind people about their appointments. We know that villages don't keep a diary and don't keep a calendar like you prompted from your handphone and your laptop. They get SMS alerts, and mobile penetration is fairly good today in villages. So they get alerts on 2 days before the camp, 1 day before the camp, on the day of the camp, and this is completely tracked, and this is a program that's funded. So private eye care hospitals are very happy to be able to pick volumes using this innovation. The third area of innovation that I wanted to touch on is pregnant mothers and infant children. There are 855,000 Anganwadi workers in the country. And if you look at them, this is the kind of activity that they're doing today. And if you look at it before this innovative solution, they used to have manually written registers, which is now completely automated. They used to have 14 plus registers in their daily course of work, and now there's minimal data entry. They used to plot stuff manually. It is now done automatically. Reminders, again, were manual, and now it is done automatically. Malnutrition was one area where they're not able to address, and it is being done automatically now. And, even the attendance, earlier it was being fudged, and those of you from IT will say that, today they take a digital photograph and they're able to identify if the number of attendants actually fits to the number of people who are in that photograph. So these are 3 areas that I wanted to touch on, and there are several other areas that we are driving innovation. Feel free to reach out to the Accenture folks around in terms of how to do innovation. There are several areas beyond this, from the back office in healthcare to the doctor's office in healthcare that we are working on, and with experience of driving healthcare programs across the world, we bring that to India. So feel free to reach out any Accenture official that's here to talk about innovation in healthcare. With that, and with the permission of the Honorable Chair, I will conclude the session. Thank you very much.